Hello, everyone. Good afternoon, distinguished guests, doctors, colleagues. On the behalf of Beyond Public Health, we welcome you all to this event. Beyond Public Health aims to educate the students about the obstacles Thailand faces in implementing effective public health policies, to inspire students to advocate for the good of all as healthcare professionals, and to allow students to consider the larger perspective of public health policies. I'm P. Mpoksuweshkun, a second-year medical student at Julapon International College of Medicine.
And I am Timbovi Thongkongtun, a second-year medical student at Julapon International College of Medicine, and we will be your hosts for today. So, we would like to begin this Beyond Public Health conference titled From Zero COVID to an Endemic. Have we learned the lessons from the pandemic? Hosting by Beyond Public Health Organization with the cooperation of the International Federation of Medical Student Association of Thailand, as well as IFMS ACICM. So without further ado, let's move on to our first session. As the number of COVID-19 cases in Thailand is rapidly increasing, hitting new highs every day, public health policies are a critical tool for dealing with these issues.
Yeah, and it is our honor and privilege to invite our distinguished guest, the former Prime Minister Abhisit Vejjajiva, onto the stage for our first section centered upon public health policy. Please welcome the former Prime Minister, Tan Abhisit Vejjajiva. Sawasdee krab.
Sawasdee krab. Good afternoon, everybody. Thank you to Beyond Public Health Group, who has organized and hosted this event and has given me an opportunity to share some of my thoughts with all of you on the issue of COVID, the issue of public health policy in general, and also the Sustainable Development Goals, all of which are very, very important for all of us and our future. Because the scope or the breadth of the topic is so wide, let me just dive into the first session where we will focus on the issue of public health policy as related to what we should be learning from our experience with the pandemic. And I will try to make my comments as brief as possible because there will be quite an extensive session for questions and answers where we could probably elaborate or maybe focus on particular issues of your interest. So I would just say that in this session, I would say that there are three very important lessons that need to be learned from our experience with the pandemic. The first will be related to the global picture. The second, homing in now on what has been happening here in Thailand and what kind of approach is needed for us to develop a good public health policy. And the third is maybe a guide to the future about what we need also to do to strengthen our preparedness for events or uncertainties or disruptions like the ones we faced over the last couple of years. So the first lesson, and this is an issue that I think maybe is still not being talked about enough, is one concerning the issue of global governance. COVID-19 has been declared a global pandemic. And clearly it is, like many, many problems that we face today, transform borders. Despite the efforts of countries, even when they try to seal off their borders, the fact of the matter is this kind of issue, this kind of problem transforms borders. Otherwise, it would not be declared a global pandemic. Yet, 2 years on, we have to say that the world clearly lacks a good system of global governance in dealing with issues and problems that arise from globalization. While people, you, me, everybody in the world has been tuning in their lifestyles to the globalization phenomenon, it is clear that global system of global governance has clearly not kept up with the pace. And this is not just related to the issue of public health. We see it in a number of financial and economic issues. Cryptocurrency, for instance, is a big challenge now. We see it now with events unfolding in the Ukraine about security, where we lack a truly international, multilateral, global organizations that have the power and the cooperation from nations to deal with global problems. So let me just take you back a couple of years and imagine that if we did have a good system of global governance, I think the various countries' responses to the pandemic would be much better coordinated than now. And if you imagine going back a couple of years, in early 2020, when COVID was prevalent in Wuhan in China and began spreading to some Asian countries, and now, or then there was a possibility, of course, of spreading to other continents. If there were a good system of global, even regional governance, and there was a coordinated response, for instance, just for the sake of argument, there was a coordinated effort on all governments to organize a shutdown, a lockdown. Would it be the case that the whole thing might have been over by 2020? All right, some of you may argue that maybe the virus will still somehow escape, but the fact of the matter is 2 years on, we do not see any kind of coordination. Today, you still have China pursuing zero COVID policy, and you have, say, the UK now lifting all restrictions, almost declaring now that it is an endemic. And yet, you still see the transmissibility of this virus across borders all the time. So just beginning with the response of various governments, and I know the WHO did try to make some efforts, although the WHO itself was also at fault in the early days as well on issues like the transmissibility of the virus and also on the wearing of masks and so on. But even today, we do not see any kind of coordinated efforts of various governments, maybe organized by some kind of multilateral international organization, to have a unified response. And this is even more costly when you look at the issue of the vaccines, particularly vaccine distribution. You had a situation where many rich countries were able to hoard the vaccines. Many had ordered vaccines to the amount of maybe 3 times what they need for their entire population in the early days. And in some of those countries now, people have had maybe even 1 or even 2 booster shots. And there are still many places around the world where people are still waiting for that first shot. And this is not just a question of unfairness or inequity, a distributional problem, but it also means that the longer we allow the virus to be transmitted anywhere in the world, there continues to be risks about new variants emerging and then coming back to reinfect the countries that had thought that they were safe because they had immunized or they thought they had immunized people within their borders because of the abundance of vaccines that they have. So I think this is a question not just about equity, but also about efficiency and effectiveness of how we deal with these kinds of problems, which are cross-border, regional, or global in nature. And I'm just surprised that governments around the world have not really been making much of an effort or even talked about this issue in terms of how we might strengthen our system of global governance in responding to the pandemic. That's one lesson that's often not talked about, and I think it's very important. So now, coming back home to Thailand, and the second lesson that I would say that we need to learn is that in the end, when there are public health issues or problems such as a pandemic, we need to take a holistic approach to this kind of problem. And I'm glad that the group organizing today's event calls itself Beyond Public Health. I think in recognition of the fact that even problems like this are not simple technical problems that can be solved by professionals or specialists. But in the end, because it relates to behavior of people in society, behavior of people in the country, it relates to the economic and social systems that are in place that will determine the evolution of the events concerning the pandemic, that we therefore somehow need to look beyond just the technical problems or seeing this as a technical health problems. Indeed, early on, when the pandemic struck Thailand, I was one of the few people who warned that we mustn't try to present the problem as if we had to choose between public health or the economy. In fact, what we have to think about is how we achieve maximum well-being for people in general, which means striking a balance between health, safety, and also taking care of the economy to make sure that people's livelihoods are not too adversely affected by the virus itself and also by the policies and efforts that are put in place. And when I argued that it wasn't really a choice between one or the other, I pointed out that if you thought you could choose to say coming on the side of the economy, and you don't try to control the disease, in the end, there is no way that the economy will be able to recover or grow. And that's clearly the case. And one interesting thing is, over the last couple of years, we've seen people trying to assess the effect of government announcements and policies. But I think for those people who have studied the mobility of people, how the movements of people, maybe using tools like Google Mobility or whatever, it is clear that oftentimes it wasn't necessarily related to government decisions. People made their own choices about whether they wanted to go out, about whether they want to take a risk, and so on. And so, when, and I will go through the chronology of what we went through in Thailand, when it was clear that the government became too concerned with the economy and started relaxing restrictions, in the end, when the numbers shoot up like they do now, but certainly during the Delta wave, when people were very afraid of the severity of the disease, what we saw was that in the end, operators in the services sector will not be able to do their business anyway. So it's not as if that if the government can say, okay, we'll sacrifice something on the health side and support the economy by opening everything up, that the economy can actually grow or recover in the way that is intended. On the other hand, when the restrictions become too restrictive and people begin to feel that somehow they can't get on with their lives, what happens is public sentiment builds up and goes against further government efforts to try to announce restrictions. And you could argue that the lifting of restrictions around the world, and many times here in Thailand, if you look at the timing of the restrictions, and look at the numbers of infections at the time, they don't necessarily relate to each other. And I would argue that most of the lifting of restrictions in recent times, certainly this year or towards the end of last year, in almost all countries, was not because the government was now more in control of the number of infections, but it was because they could not resist the public sentiment that was crying out about their economic sufferings and wanted somehow to put an end to it. So it wasn't really a binary choice. And basically, I think that the trick has always been to make sure that the disease does not overwhelm the public health systems. So the hospitals are not overcrowded, so that we could treat people who have this disease and the degree is severe. And at the same time, making sure that we steadily immunize people and bring things back as close to normalcy as possible. I think that should have been the approach right from the start. That's not exactly quite how things turned out. And now, if we wanted to learn the more detailed lessons, if you like, of what has been happening, I'll just quickly run through what has been happening chronologically here in Thailand. I think the first wave back in 2020 demonstrates that, in fact, Thailand's public health system is actually quite strong. And I think you will have read also that assessments around the world would support that. When I say we had quite a strong system, was first of all, it's a matter of fact here in Thailand that, you know, our brightest people are mostly in the public health or medical profession. That's just due to value system here, certainly in my generations, and also still prevalent among the current generation, that the brightest people often go into this profession. So we have, here we have a field where we could almost say we are almost second to none compared to the rest of the world. And these very able group of personnel had been instrumental in designing some of the key aspects of Thailand's public health system right from the start, with very important innovations. We have the Thai Health Fund, we have the universal health coverage policy in place, we have a system of health volunteers, which are very, very effective in rural areas in spreading the right information and also taking care of people when there are health issues or health crises like this one. And so I think by the middle or towards the end of the 2020, Thailand's success was all for there to see, for everybody to see. We managed to control the disease very quickly. And you know, it was pretty much an undisputed success. And then when the second wave started striking us, and that is, I think, towards the end of the year, with the leakage, if you like, coming from foreign workers, particularly in provinces where there were many foreign workers around. And that carried on right until the next Songkran of the next year, where there was then a very big wave of infections as well, and the Delta variant. And I think what happened then was almost, we became victim of the success that we had in the first wave, in the first year. I think despite what the government might try to say, you have to say that there was a degree of complacency setting in. on the issue of vaccines is clearest, where I think the planned rollout of both the production and distribution of vaccines was not really tailored to deal with the breakout of infections in the beginning of the year or in the middle of the year, because the government had planned that we would start vaccinate people in the second half of that year. And of course, there was a big controversy about, in the end, how the government then procured vaccines, the quality of vaccines were being disputed, and also then the distribution. It was also clear that because of the success in the first year, and there was this feeling that I'd warned about, that people started saying, hey, maybe we paid too high a price economically. That meant that for the second wave, the government was clearly much more reluctant to impose restrictions. And that contributed to the acceleration of infections that almost got out of control. And we had a situation where field hospitals had to be set up. People can still recall images of people actually dying in the streets. Added to that, I would have to say that despite the best efforts from the medical profession and those in public health sector, the breakout of the second and third wave, you could argue, exposes weaknesses elsewhere in the Thai system. That is to say, I talked about the foreign workers that somehow escaped regulations or monitoring. And it was argued that the third wave that broke out maybe from, let's say, well-to-do or influential or powerful people not observing the rules in entertainment areas like Thong Law and so on, that was responsible. So again, what I'm trying to say to you is, the lesson is that this is not something that you could just focus narrowly as a technical health problem. It relates to enforcement of the law. It relates to how governments respond to the public when something like this happens. And one of the things that even during the first wave, I thought was found wanting or lacking is this issue of information and communications. Even the success in the first wave, what I thought was effective communication was all when the government was reactive or defensive. So problems happen here and there. The government was able to say, look, this is how we were going to respond. But throughout the pandemic, we hear very little about the vision of governments projecting some kind of forward thinking to bring the public along exactly as to how, in terms of strategy, we are going to deal with the pandemic and bring it to an end. And I think that was particularly frustrating with the issue of the rollout of the vaccines, where there was so much controversy and confusion. And 2 years on, I have to say that we still have this problem. I don't know about you people in the audience, but you know, for the first 2 shots of vaccines, we at least had some kind of system. You know, some people were with the Ma Prom, some people were with Thai Ruam Chai, some people were in the social security scheme, some people were taken care of by their employers or organizations, both in the public and private sector. Suddenly now with the booster shot, which actually now has been proved to be important in warding off Omicron infection, there is no system. Everybody has to find this 3rd or 4th shot for themselves by, you know, trying to search as to when the vaccine or what type of vaccine would be available and have to compete to register and so on. So the whole point of this second lesson that I am highlighting is that in dealing with these kinds of issues, you have to take a holistic approach. You have to coordinate your health and economic or social responses. You have to be able to communicate with the public so they understand exactly where the country is heading or it's trying to head. And therefore, you will be able to receive good feedback and cooperation to adapt your policies as you move ahead. So before I go on to the third lesson, I should say that this problem of communication is now manifesting itself with the current situation where the government is now sort of trying to tell us that we are about to treat this as an endemic. When I say there is a problem about communication here is that I think there is a real risk that the public misunderstands what the difference is between a pandemic and an epidemic and an endemic. And I don't know about, I mean, you are more qualified on issues of medicine and public health, but I can say that for the general public, when they hear a message like this, number one, they think that the situation has improved, that it is going to be less risky and less damaging as a disease. That's not exactly what an endemic means. On the contrary, it is almost now as if when we say it's an endemic, is that we are saying that this is going to be with us no matter what we do. All right. In a way, it's almost saying that we have given up on the idea of zero COVID. And what I'm surprised is that with all the information that the government has, they should really be trying to inform and educate the public on key issues. I mean, I've been talking to my former colleagues in the political world, particularly those that can somehow communicate to those in power and in control of the situation, that, for instance, they should really have a good system of publicizing not just the number of infections, which we see daily numbers, although still with confusion because of the ATK numbers not being integrated into the system, but also the key that they should be telling the public is the number of hospitalizations, those that still have problems with their lungs, and those on respirators, ventilators, right? And break that figure down about who exactly these people are that are being hospitalized, that are still reliant on ventilators and so on. Severe cases. Have they had 2 shots, 3 shots, 4 shots? And again, 2, 3, 4 is also meaningless because if you do 2 Sinovac or Sinopharm vaccines, that should, I think, most simplistically be counted as 1 and so on. How old these people are there young people? Are there children that can still get severe disease? Is it just being confined to people over 60, 70, 80? And also what other diseases that they may have already as risk groups. This would then give people a much clearer picture of how we're going to live with COVID, what the risks are and what kind of action they have to take. So for instance, for me, I feel that I should be able to handle Omicron if I'm infected. But because I'm regularly in contact with my parents who are elderly, who are not well, I then have to think about the risk that they could easily catch this disease and also become severe cases or maybe even lose their lives. This is the kind of communication that I would like to see so that people can make informed decisions and not just being told that, oh, it's now going to be an endemic and so on. And the confusion that is going to follow will also be all about the rights of people in terms of access to healthcare. Already there are arguments going on about the inability now to get tested freely. Hospitals now begin to charge certain patients and so on. So I think in a way, I think we have not yet learned this lesson that we need to take a holistic approach and be able to bring the whole community, the whole country, the whole society along in a well-informed path as we move ahead. I concede that there will always be uncertainties, there will always be risks that are unforeseen, but we would be in a much better position to deal with them if we took this approach right from the start. The final lesson, my understanding that is that the time for the first session is almost up, is that despite all the progress that we have made in health and public health, and we here not just in Thailand but in the whole world, and we have to be impressed at the speed with which we can now find out the genetic sequence of the various variants and of COVID, that we can quickly design or discover a vaccine, tweak it using mRNA technology. Despite all of that, one of the key lessons is that we have to recognize that there is still a lot that we don't know. And even today, some very, very important questions, like say the subvariant of Omicron, which is more transmissible, still debatable whether it's more severe. We don't yet learn quick enough about the ability in terms of gaining immunity either from vaccines or from previous infections. We can have no knowledge or cannot be certain about whether there would emerge new variants and whether those new variants will be more transmissible or more severe or would be resistant to the immunity that we gain from either vaccines that existing vaccines, or even if we had previous infections. And so we have to brace ourselves for continued uncertainties and risk. And there are three things here that I think is important. Number one, that means that the risk management system, whether you look at it from the point of view of public health, from the point of view of managing the economy and so on, needs to be strengthened. The second is that we have gathered so much information over the last couple of years. We have so much information about people's behavior, about their status concerning health, concerning vaccination, concerning assistance that they get economically and otherwise. We need to consolidate this information system and use it much more effectively and efficiently to deal with all the problems that we've been through that might re-emerge. And there are also other lessons that we could learn, but I don't have much time to go into detail. For instance, I think and I'll talk about this when we do the second session. One of the things that COVID has done is to expose the degree of inequality and inequity in most societies and also in Thailand. And we need also to design better policies to recognize the uneven impact on various groups of people from the pandemic, from the measures that governments impose. Simply put, for instance, social distancing, which is obviously the key to preventing infection, is clearly a luxury good. When you live in congested communities, when you engage in manual work, you can't work from home. I mean, all this is almost a luxury. The informal sector in the economy suffers much more. So economic assistance policies should be designed with better targeting to make sure that we use the resources we have effectively. And the one last issue that I will mention is on the issue of vaccines itself. I have always been arguing that our intellectual property system needs to be reformed. I don't see why we should allow companies that, although they are very instrumental in rolling out vaccines and discovering this, to make huge profits. I'm not saying that they should not be rewarded, but there should be a better system. And we have seen a glimpse of it in the case of AstraZeneca, where the public sector contributes upfront to the research for this in exchange for having this vaccine be available at cost and not at huge profit margins. These are the kinds of lessons that I think we need to learn, and I think there is a lot to learn. We need to discuss it much more at the global level, at the regional level, and at this kind of level, so that we are better prepared for the future and improve the design of our public health system. I think that probably should be it for the first session. Thank you.
Thank you, Abhisit Vejjajiva, so much for your visionary and perceptive speech on our public health policies, especially the clear parts such as the global governance, where we lack of global organization. As a result, many countries cannot coordinate on policies and not agreeing on restrictions, which really needed to be taken care of.
Yeah, so now we would like to hear the audience's opinion on the matter in our Q&A session with our first moderator, Kun Thitikan Jingthira Panit, who's also the co-founder and the academic director of Beyond Public Health. Please welcome Kun Thitikan.
Thank you, Mr. Peen Pongsuklishkun, and good afternoon, everyone. My name is Thitikan Jingthira Panit, and first of all, I would like to say thank you to our former Prime Minister, Than Abhisit Vejjajiva, for delivering a very good presentation. Now we have come to the Q&A section based on the presentation given by our former Prime Minister. And since we have so many questions delivering to us from the registration form, we have picked the best questions and would like the former Prime Minister to answer and express his opinions toward the questions. We will start with the first question. On today, Thailand has reached almost 40,000 new COVID cases with 45 deaths, leading to many public criticisms on how the authority deals with the problem. Of all the public frustrations following the several new waves of COVID-19 outbreak, what do you think are some of the structural obstacles that Thailand is facing? And what do you think is the solution to those obstacles?
Yeah, I touched on this during the presentation. I think we are now moving into a stage, like in many countries, where governments can no longer resist the pressure from the economic demands. So I think most countries are now completely unwilling to place stringent restrictions in trying to control the disease. They are, in a way, supported by the fact that, yes, it is true that the Omicron variant, which is now the dominant variant, appears to be less severe. But as I mentioned, it doesn't mean that everybody is safe. And therefore, what I think needs to be done is my demand for some kind of strategic vision that the government must share with the public. At the moment, when the government starts saying, oh, maybe we should not publish the daily numbers of infections, nobody in the public thinks that that's strategic. They think it's because they're trying to hide the numbers. And when the government says, oh, well, maybe the access to health would no longer be free like over the last 2 years, again, the public doesn't think that's because this is turning into an endemic. The public thinks, oh, maybe the government's running out of money. So I think the government needs to be forthright about exactly what the thinking, what the rationale behind the moves that they are making. And I think some key statistics should be presented. So I mentioned, for instance, that if, okay, they're going to say it's more important to look at the number of hospitalized people, number of people with severe cases, number of people on ventilators, then tell us, are the people in hospitals fully vaccinated? Are the people hospitalized or elderly people? So the public can gain knowledge and manage their own risks. Okay, since the government is no longer willing to make restrictions or to give out orders about how we should live our lives. So that's the first thing. The second thing is whether you think it's turning into an endemic or not. You have to say that the vaccination program is still essential. And I don't understand why the government that has all the information about you and me, how many shots we've all had, cannot actually organize and prioritize who should be getting the next shot, what kind of vaccine you should get, and have this rollout plan like that, so that the immunization program would be able to deal with the continued infections much more effectively. I think this is the kind of thing that I would like to see.
Thank you for your wonderful answer, Mr. Former Prime Minister. Now, I would like to ask you the second question. It's about the international comments on Thailand vaccines policy. So the question is, according to the international comments on the Thai vaccine policy, the Thailand has turned from one of the best countries in terms of response to COVID-19 to one of the worst. Would you think it is true, or would you think that it is not?
Yeah, I mentioned that I think there was a degree of complacency that set in after the initial success. I don't know if this is any consolation, but I noticed that this seems to be the case with all the countries that were successful in the first year. Many countries that were successful at controlling the infections the first year all appear to have a very slow vaccination program in terms of rolling out and distribution. But as I say, is that a consolation? I don't know, but we have to admit the fact that I think there was a degree of complacency, and that was where I think things became unstuck because of the slow vaccination rollout.
Thank you for your answer, Mr. Former Prime Minister. Now moving on to the next question. Now let's talk about the Thailand's top priority during this time of pandemic.
Sorry?
Okay, so as you can see in the screen, according to the poll asking whether which topic should be the top priority during this time of the COVID pandemic, we found out that the healthcare accessibility and affordability are the major concerns. And the question is, do you agree with this poll result, or do you think that there are all the concerns that we should be focusing more on? Okay,
right, let me just have a quick look. I mean, all the issues that you've presumably this is not an open choice, right? You gave them these choices and voted, or was it an open question?
Yes, we give them like the
choices.
Yes,
yeah, they're all important, and I can see that. I mean, accessibility and affordability obviously is something that is most desirable. But again, I mean, what came second is vaccination. Again, the preventive measures are equally important. The others, I guess, are a little more detailed about the testing, about the communication, which I also emphasized earlier, but also community-based. But I would say one thing that could help with all of this, and that is to say that if you look at the way our health system has been designed, if you look at the role of non-governmental organizations when the situation was really bad last year, you sort of wonder whether the government can do so much more to facilitate them. You know, we had so many effective networks of ordinary people helping people find beds, hospitals, telling them where they can get vaccines, where they can get testing. And that's the kind of system we would like to promote. You will see that I mentioned at the start the role of our health volunteers. I think they were very effective in rural areas. They're as effective as any app you could have designed on tracing and so on. And you will notice how the worst place in terms of coordinating system is actually Bangkok. And that's because we have a very fragmented system here. And so I would say that if we could redesign where there is better coordination and better participation from non-governmental players, all the priorities that have been highlighted here could be more effectively addressed.
Thank you for your answer, Mr. Former Prime Minister. Now we are on the last question. What can we, as the Thai citizens and also especially as medical students, can contribute to our nation, especially during this time of pandemic?
Well, you do your job, you inform people, and I think you have to make some noise about where improvements can be made. You know, I should mention that one of the things that I forgot to say was that when compared to Western countries, we are blessed with the fact that we have a public that trusts the medical profession, that trust the experts. So we don't have the headaches of people protesting against wearing masks, protesting against vaccination. And I think the degree of compliance on the whole is pretty good. I think it surprises a lot of people. We often say to ourselves that Thai people are never disciplined. But I think during the first year, certainly of the pandemic, I thought the public responded to government's requests or orders very, very well. So I think you could play a part in reflecting both the successes and failures, the strengths and the weaknesses, so that we can all help to design a better system. And I think you have an audience that are willing to listen to you because they trust you more than they trust politicians.
Thank you, Mr. Former Prime Minister, and thank you for all your visionary answers. And next, I would like to pass the spotlight back to the MC to continue on to the next section. Thank you.
Let me just add one more point that I would like to make before we move on to the SDGs or whatever. Just a thought exercise for you and for me, because I don't think anyone has the answer. Do you know when the pandemic broke out, I kept searching on the net about how the Spanish flu ended. I was never able to find a proper answer. And I was surprised people kept comparing this to, the Spanish flu 100 years apart and all that. But in the end, the Spanish flu seems to have faded out after about 2-3 years and maybe turn into normal flu or whatever. The question that we should ask ourselves, and I'll leave you with this thought exercise. How come 100 years on, with all the knowledge that we have gained, with the new technology, we couldn't bring COVID to an end sooner than the Spanish flu ended? And maybe we will have to look when this is all finished, if it ever finishes. Despite all the progress we make, have we been able to deal with something like this better than the people 100 years ago? Just a final thought exercise for you.
That was a great question, Mr. Former Prime Minister. Thank you for your opinions and answers. And now I would like to pass on the spotlight back to the MC to continue on to the next section. Thank you.
All right. So thank you, Kuntipikan. That was such a very fruitful session. And the exercise question at the end about the Spanish flu is really something that we need to consider, right, team?
Yeah, most definitely, Vivi. I thought it was very intriguing, and I was fond of the question as well, because if you think about it, the pandemic during that time, the technology was not on par as now 100%. And it is very intriguing. I'm very surprised, and I'll go back and have my train of thought later. But
I thought you were going to have the answer for me.
I'm afraid not now, sir. But I'll definitely think about it. So now we're going to have a 5-minute break so the Prime Minister can take a water sip, and we'll meet again at 2 p.m. roughly. And maybe we remind you that the link for today's Zoom background is in the chat box. And it's important because we need to prepare your background so we can have a good photography at the end of the session. So we'll see you guys at 2 p.m.
Let me just say that for me, the background is not going to be, I'm not going to be able to use the background because of the...
Oh, you're totally fine. You don't need it.
Okay.
All right.
Yeah. See you in 5 minutes.
See you.
Thank you. All right, so welcome everyone back to our second session. The Sustainable Development Goals or Global Goals or SDGs are a collection of 17 interlinked global goals that are designed to be a blueprint to achieve a better and more sustainable future for all. Thailand is one of the 192 nations that have agreed to meet the Sustainable Development Goals or the SDGs at the United Nations since 2015, with the goal of doing so by 2030. We'd like to welcome back to the floor Khun Abhisit Vejjajiva for a discussion on the overall well-being of our public health policy, including the integration of SDGs. So please welcome Than Abhisit back to the floor again. Ka.
I'm so sorry, your microphone is not open.
I think you're still muted, sir.
Okay.
All right.
You prevented me from unmuting for a while. Okay. Just recall the last session when I talked about the second lesson and the need to take a holistic approach. This is very much in the spirit of why the Sustainable Development Goals came to be. And I think it's important always to go back a little to see how all of this has evolved, to be able to understand exactly what we need to do as we move forward to try to attain the goals by 2030. I have to say that the Sustainable Development Goals succeeded what were called Millennium Development Goals. So those of you who are not as old as me may not know that was the case. And the Millennium Development Goals emerged motivated by the idea that economic growth wasn't the answer to everything. I think the way the Millennium Development Goals and subsequently the Sustainable Development Goals were developed was in recognition that while most countries, if not all, were competing economically using mostly GDP or GDP per head and growth as the only indicator, you found out that while many countries have achieved high growth, high income, they were not able to overcome a number of problems. And even until today, when there are surveys on happiness, it is also the case that happiness doesn't directly relate to the level of income or average income in that country. And so I think for a long time, economists and also other professions were questioning the need to somehow strengthen the goals or indicators where we might be able to measure our qualities of life. So for instance, in many high growth countries, they were using resources in irresponsible ways and therefore created environmental problems. And that became more and more important as it emerged that the damages they were doing was not only just to their own environment, but the whole world, the whole planet. And therefore, somehow we need to find growth that is environmentally friendly. We see a number of countries that embark on high growth paths, in the end hit some kind of cycle or became a bubble that burst. So we had financial crisis turning into economic and social crisis, and somehow the growth was not able to be sustained. We have countries where growth is not balanced. So sometimes they hit speed bumps because of inflation, because of current account deficit, because of the pressure on that currency, and so on. And almost most significantly, we also see that the average rate of growth says nothing about the lives of ordinary people. One of the most, I think, telling and for me important indicator is like a country like the US, where 20-30 years average income, mean income, has been growing steadily, but the median income has barely moved, which means that for ordinary people, they're not better off, and that there is an increased degree of inequality. So whether you talk about the these concepts, alternative concepts to pursuing economic growth just on its own, to the development of Millennium Development Goals, and then subsequently the Sustainable Development Goals that we talk about, this is where the motivation comes from. That ultimately, surely we want to be aiming for good well-being of people, which therefore needs a more encompassing and a set of balanced indicators to tell us where we are in terms of achieving well-being as a whole. And as you'll be familiar with, we have these 17, and the key word you should stress is interconnected goals, and often now classified into 5 P's, so it's prosperity, people, peace, planet, and partnership. And they have been monitoring the progress that all the countries have made. And I don't know whether you know exactly where Thailand stands. As far as I can see, among over 100 and something countries, in terms of progress, we rank around 43rd, I think, or somewhere around there, with a country score of around 74. The highest scores would be in the 80s. And there are a number of countries that would be maybe in the 60s and in the 50s. So we don't do too badly in that sense. We seem to be making progress, and as a high middle income country, it is, I guess, we are where people expect us to be. But the interesting thing is, we need to look closer at the differences in terms of progress that we make on the various goals. And so my comments or my remarks will focus on taking a lesson from why we are doing well in some issues and not so well in others, so that we can design the appropriate approach for development to correct this. As expected, I think the most progress that we have made apparently is on the goal number 1 itself, which is on poverty. And I mean, this shouldn't surprise you. Whenever there is some kind of international ranking like competitiveness and so on, as a whole, we have not been doing badly macroeconomically. And we have been able to use growth to steadily reduce poverty, although there is a big caveat that I will come to in a second. On most goals, we appear to be making progress. Some, I think, may be on track. Others maybe need to be accelerated. But there are 3 things that I think, two main areas that I would like to draw your attention to. The first is that we are not seen to be doing well at all on the issue of climate change and the environment. And particularly the goal of life below water, goal number 14, where we do rather poorly. So I think that suggests that this is an area that needs to be addressed. But there's one goal where there has been a negative assessment, and it surprises people, and that is goal number 2, which is zero hunger. You would have thought that for a country like Thailand, a high middle income country with steady growth, I know we would like to see maybe a higher growth, and we say that we've managed to reduce poverty. But the issue of hunger is seen to be is seen to reemerge, and that is despite the fact that we have one of the lowest rates of undernourishment. We seem, according to the people who assess this, to not make enough investment in agriculture. And because we also are faring rather poorly on the environment, there is a risk that for a country and the people that always pride ourselves on being so abundant in food, that's not necessarily going to be the case. And some people will say that's no longer the case in Thailand unless we drastically invest, improve productivity, and be able to handle the effects of climate change on the agricultural sector, as well as the need for a balanced nutrition program for our people, our children. When I was in politics, you know, I travel up and down the country. There's one thing that always hits me as a stark reminder of inequality, and that is when I visit faraway rural places at the schools. I see so many small, undernourished children. On the other hand, when I tour Bangkok schools, there were too many kids with the problems of obesity. And this is all, you know, something that we need to heed as a warning about the inequality, about the unbalanced progress that we are making. And so just looking at these variations in how well we do in the various goals, you come to the following conclusion: that in the end, despite all the talks from the planning agency, from whatever philosophy of managing our country, the country and the government is still very much stuck in the old paradigm, where they think that growth generated by trade and investment would somehow trickle down to everybody and solve all the problems. It will buy us, you know, infrastructure. It will buy us a good health system. It will buy us a good education system. And if there were any kind of side effects, if you like, or damages that come from this approach to growth, we'll correct it. So if there were damages to the forest, we will try to stop that and reforest. If there was air pollution, we will try to then control it. And I think this approach, if we see the way we do things like this, it fits in with the assessment as to why we're making progress in one goal and not doing so well in others. But the problem now is deeper than that, because number one, COVID has undone even some of the goals that we have been able to do well in the past. And even before COVID, actually, I think the limits of the approach was being exposed. I don't know if you know, but even before COVID, we began to see absolute poverty rising. That never happens unless there was a big crisis, like say the financial crisis of 1997 or the Lehman crisis back in 2006 and 7. But recent income surveys show that absolute poverty keeps rising either in provinces or even at the national level. So that suggests that we are somehow hitting a limit on the approach to achieving even growth itself. And then if you look at the other things that we haven't been doing so well, as I say, it gets exposed by COVID, the inequality, the effect then on the management of resources and the environment, and so on. And what's worse is that we are now facing a number of challenges that are new. Well, not exactly new, but were not there when the SDGs were developed. The first is the technological disruption, which calls for a different kind of education system, a restructuring of the productive sector in the economy, and so on. The second is climate change itself. The third is that we are rapidly aging as a population. So we have both the problems of more shortages of labor and also the lack of a good welfare system to support the vulnerable and the elderly. So not just the aging population, but from technological disruption as well. And rising health costs, rapidly rising health costs. All of this means that suggests that we can no longer not take the holistic approach and hope that if we somehow can generate economic growth, aggregate economic growth, that we can then bring all the other goals along with progress. That's not the case. And you know, there are every now and then I can see that the people in power, people in charge are still stuck in this old paradigm, that they don't somehow try to see that it's all connected. So let me just give you a couple of examples. You know, in recent times, whenever there are economic difficulties, the standard response now is for government to transfer some money to people, right? But it took the government so long to redesign this system of transfer in a way that it would reach ordinary people. They managed to do it for the first time with the projectคนละครึ่ง. Because before that, none of this money would ever reach people in the informal sector. And all the money just goes back to the modern retail sector, the telecommunications companies, and so on. And this is now a big structural problem, because I keep saying now that it's very, very difficult these days to help the poor without helping the rich. Because as soon as the money reaches the pockets of the poor, given the way the structure of the economy is evolved, that money is soon going to be sucked back to the big companies. And so they need to redesign this. But it took the government so long, you know, before they tweak the system so that this money would actually reach ordinary people, SMEs, and those people in the informal sector. Another example, you can have the Thai leader attend the COP summit, come back and say, look, we've been to the COP summit, we have announced we will reduce our carbon emissions. And then the next week, they approve coal-powered plants to generate electricity. So they're not treating these goals as interconnected. They think, oh, we'll do growth and then we'll fix the problems, almost as an afterthought. This approach will no longer do. And so the challenges now for me, I think, is in order to achieve the SDGs, is to, first of all, practice what I would summarize as the 3 R's. The first R is we need a process of recovery. because the last few years, I mean, I could argue that even before COVID, but especially with COVID, much of the progress that we've made in many, many areas have been undone. And there is an urgent need for us to recover. And I was disappointed by the priorities and distribution of all the money that this government has borrowed to spend during the pandemic. It should have been much better spent by strengthening the health sector as a priority, and also to try to fix some of the imbalances in the system rather than trying to find quick fixes and just think of money as to stimulate the economy by just throwing it around. So the first thing is recover. The second R is we now need to rethink and redesign our growth paradigm. And that is to say that, when we undertake whatever policy, especially economic policies, economic measures, we don't just look narrowly or focus narrowly on some kind of indicators. For instance, when the government says it wants to attract more foreign investment, that they would give more tax breaks, that they would allow maybe land holding or purchase of real estate, exemption from this and that, even city planning, town planning, even some environmental standards. That is no way in spirit of sustainable development, and we have to change that. The government, for every incentive, every measure, project, policy decision, needs to take into account the impact on the whole picture, including the environment, including health, and I would argue also including the distribution effects. Right? So again, going back to the idea that I've seen, measures to try to attract foreign investment. Some of the investment that comes in, number one, employs very few Thais. All right. So maybe capital intensive, maybe ask for exemptions so they can hire foreign labor. So it's not generating employment for Thais. Sometimes this is for export and probably uses up our quota of export. Profits are repatriated to the motherland of the foreign company. And it might generate pollution here in Thailand. Right? The question is, well, what does that investment achieve apart from a figure that says we were able to attract so and so million bahts or dollars of foreign investment? You need, I think, now to rethink, redesign the paradigm of policy decision that fully takes into account these interconnected sustainable development goals. And from the recovery process and from this redesign and rethink of the paradigm, the third R is then to restructure the public sector, restructure the economy so that it is conducive to inclusive and green growth. And one of the big challenges that we cannot shy away from is that we're now going to need a proper and strong and sustainable welfare system to look after all the vulnerable groups in society, and in order to meet the uncertainties of the future, which is expected to be, more volatile for everybody, including you and me. Don't think that you're in a highly skilled profession that in the future, artificial intelligence cannot replace you. So, you know, for the medical profession or the health sector, I keep saying that, well, doctors are probably more at risk than nurses because, you know, a good system of artificial intelligence with big enough data will probably be able to diagnose patients as well as doctors. But robots replacing nurses, possible, but not as easy and maybe not as popular. So all this means that we need a welfare system, and that creates an additional question that if we want to design a welfare system that is effective enough, strong enough to give people security, we clearly need to revamp our tax system because we don't have enough income to have a strong welfare system that we want, that will then be able to deliver the goals concerning health, concerning education, concerning quality of life, and so on. And that has to be restructured. And I think, you know, the well-to-do people have to pay their fair share. We need to address the increased concentration of economic power and monopolization in our country in order to stop the structure of our economy becoming more and more unequal. That generates conflicts further down the line as well. And we also need to decentralize our whole public sector and be able to have a more flexible, nimble public sector that can respond to changes and challenges that can be more abrupt, as well as design a system where, as I mentioned before, we are able to engage the other stakeholders in the country as a whole, because they will be the ones that will be able to help deliver on the goals related to climate change, the environment, and so on, much, much better than if the government thinks that it can do this on its own. Okay, so I think my time is up again. These are the thoughts that I will share with you about the need to basically to create a new paradigm on policy making and on our growth strategy in order to be able to meet all the SDGs by 2030. Thank you.
Thank you, Tan Abhisit, for an incredibly penetrating and insightful talk on holistic well-being. And I was particularly interested in how the history of the goals came from, because as the history has taught us that financial growth does not necessarily deliver to the well-being of the population. And the point of these SDGs, as Tan Abhisit has mentioned, is that they're interconnected, and to be able to develop each goal simultaneously, I think it would require a lot of change. And Tan Abhisit suggested that the changes could be like the 3 R's, which are recovery, redesign, and restructure.
I agree with Pim, and I absolutely love the part that Tan Abhisit illustrated many of his points through an easy to understand examples that all of us can understand, such as how rural students have malnutrition problems while students in Bangkok are suffering from obesity. And that reflected a lot of inequity in society that are happening right now. And absolutely love the part that, that right now I'm not sure as to whether I would have my job as a medical doctor in the future or not, as the AI are really taking that away from us. However, with these talks, I'm sure that our audiences are also having many questions about our way forward in the future. So consequently, we would like to continue with our Q&A session on the holistic well-being with the integration of SDGs with no other than Kun Thanakom Huntragun, the founder of Beyond Public Health, as our moderator in this session. So please welcome.
Thank you, Ms. Tinpavi and Mr. Beam. First of all, I would like to thank former Prime Minister Abhisit Vejjajiva for his time on this section. Since the COVID-19 pandemic, we have been focusing especially on the third SDG, good health and well-being, and set it on top of the priority list. However, the emergence of this pandemic reveals that Thailand have been driven by the interaction of multiple determinants such as ecology, socio-economic status, inequality, and politics, which requires the authorities to consider COVID to be a syndemic rather than a pandemic. It uncovers deeply rooted social inequalities and brought racial injustice to the forefront of the public health and political attention. In your speeches, it seems like you are a firm believer of holistic health and well-being, in which you do not think that there must be a choice between the economy and the people's health. How should Thailand proceed in order to incorporate SDGs into our policies, such as reducing inequality, quality education, and sustainable growth amidst the pandemic?
I think Thailand should learn from the way we've developed our public health system. You know, I mentioned before that in your profession, we have had very talented people, but also very publicly minded people who have designed and pushed through some policy innovations for a country like Thailand. You know, I talked about setting up Thai Health Fund from earmark taxes from cigarettes and alcohol to fund activities by non-governmental actors in promoting health. And then actually redefining health. That is not just physical health, it's mental health, it's spiritual health, it's community health, and so on. And pushing through universal health coverage for a middle-income country. And, you know, for engaging health volunteers. What that's teaching us is that when you take a holistic approach and you're willing to take on and push through for innovative ways of doing things, you can address well-being beyond some strict technical problem or number. And so if we take the success of the past in this area, now apply it to the way we do, say, economic policy decision-making. So as I said, you know, when you do a project, they ask you to do an environmental impact assessment or health impact assessment. They maybe now should do an impact assessment on how that affects inequity, for instance. But not just an afterthought. Not to say, well, we'll go ahead anyway, but if there are problems, we'll fix it later. But design the policy from the start to be friendly to the environment, to be friendly to public health, to be friendly to education, to be friendly to achieving a more equitable state of affairs. That's the way to do it.
Wow, I see. That was an ingenious suggestions. Maybe we should consider more about it. Moving on to our poll that the audience has done, the majority believe that good health and well-being should be Thailand's top priority still amid the pandemic. What would you think are the major concerns that are preventing us from reaching the SDGs during this pandemic era?
Well, to be fair, I think the pandemic affects all countries, and I think would put a dent in the progress of most countries as far as the development goals are concerned. And that's why I say that the first R was recovery. We need to make up for lost ground during the pandemic. But I think what we can see from the pandemic is that it has exposed all the weaknesses that we may not see normally. And in the last session, when I said that the impact of COVID has hit people very unevenly, with people in the informal sector and vulnerable groups suffering much, much more. I think it points the way forward that you need to build a system of protection and to create security for these groups.
I see. Speaking of inequalities, also from our poll, there's a sizable portion of the audience that believes that reducing inequality should instead be our top priority. The measure of income inequality, or the Gini index, is about 35, which is, we are slightly below Serbia. In fact, yes.
I'm not sure which one is that? Is that income Gini coefficient or
income Gini coefficient?
Well, let me just say this. We have to be careful that while advocating for a more balanced and holistic approach to growth, that we also don't believe that growth is meaningless. I mean, growth remains one of the strongest tools to overcome problems like poverty and various measures of quality of life. It's easier to have a growing economy than to have one that does not grow. So again, be careful not to try to make it a choice between you have to have growth or you have to have equity and so on, right? And I think that was a trap in the days of the Cold War, right? When communism promises equality, but when it was so at the expense of growth, they could not sustain it, right? And it wasn't even equal in the end anyway. So you have to be careful about that. But having said that, yes, I think it's important to tackle inequality directly. I'm not sure about your figure of Gini coefficient. And I have to say that the Gini coefficient moves very slowly. In itself, income inequality is probably not the worst part of the inequality we have. I think if you look at the wealth inequality, you will see much greater problems because the concentration of land holding, of bank accounts, balances, deposits, most of it is in the hand of very few people in Thailand. And you have to add to that the problem of the lack of mobility. That is to say that, if you're born poor, the odds are against you of getting out of poverty. And so it transfers from generation to handed down from generation to generation, which then generates more inequality. So it needs to be addressed. And to address that, we need to obviously create opportunities. And that means that we have to make sure that wherever you are born, you have access to good health and education, right? And then you have, from there, I think you would have a better opportunity at a good income employment. But in the end, you have to recognize that if the system is unfair, so for instance, there is not enough competition, there is too much concentration or monopolization or monopolistic powers in the economy, you still have a lot of inequality. And also given I guess the new, it's no longer new, but what used to be called the new economy, where technology rewards only a handful of people, but reward them abundantly. There's a big chance that this will also contribute to more inequality. And therefore, a better and a fairer tax system is also required. We can't get away from that. And if we're not willing to talk about it, I can't see how we can develop a good welfare system.
I see.
Let me just expand on this and just to give you an example. Thailand has been in the process of reducing corporate tax income from 30% down to 25, down to 20. In cases, we say 17%. We do that because we say, hey, if we tax corporates higher than Singapore, higher than Vietnam, there will be no investment here. But let me ask you this. If you look at the corporates paying corporate income tax, I think more than half is being paid by a few sectors, like banking, like telecom, like energy. Tell me, do you really believe that investment in the banking sector responds to the rate of income tax that banks pay? I don't think if there's been an increase in the banking system here in Thailand, it was because taxes were reduced from 30% to 25 to 20 or whatever. And I think what we're just doing by cutting taxes in these kinds of sectors is just giving bonuses to shareholders and to a certain extent their employees. But it doesn't generate investment. And I'm glad that the G7 has finally taken up on this issue by now saying that there should be minimum corporate income tax to stop people from racing to the bottom. Because in the end, if you reduce taxes, but Vietnam also reduced, Singapore also reduced, nobody becomes more competitive, but all governments just lose income.
I see. So taxes are also an important part of our policy. So speaking of education and healthcare, it gives the opportunity for the less fortunate to move up. But a study from Mahidol University noted a high disparity between the quality of healthcare in different provinces, with a 40% concentration of medical personnel within Bangkok and metropolitan areas. What are some of the policies that the government could implement to redistribute it?
Right. I think it's important, in all fairness, to recognize that during the push towards free education for all, during the push towards universal health coverage, you have to expect that in terms of the quality, there will continue to be unevenness or unfairness or inequality, because that was being pushed or being achieved in a relatively short space of time in order to cover everybody. But yes, you are absolutely right. We are now at a stage where on the face of it, we have, universal this, free that, but the quality is to be desired, and there is a lot of inequality. And as I say, this is where it becomes important to set priorities and use this to guide your policy-making process. I'll give you an example on education, basic education. We have often heard that the lowest quality schools tended to be small schools, right? And then there was a suggestion that maybe you should just abandon these small schools, merge them with bigger ones, right? Is that correct? The answer is yes and no. Yes, in some cases it does make sense to merge schools, but no, because in many places it's not practical for parents, for communities to do that.
Exactly.
Okay, so the first thing is it makes no sense to just say, let's have a policy of merging schools. You have to do, first of all, you have to do complete school mapping and set out criteria as to when to keep small schools. And then once you recognize that there will continue to be small schools, the system and criteria for financing has to differ. So for instance, when I was Prime Minister, schools get their budget by calculating number of baht per head of students in the school. Now in small schools, that's not going to work because the fixed costs are high, because the ratio of teacher to children has to be higher. Otherwise, you cannot provide them with quality education. So I had to design a system where for small schools, apart from getting so and so baht per head, there has to be a formula for a top up. Likewise, if we look at the local authorities, local governments, again, there should be a system of top ups or compensations for those local authorities or governments that are in areas that are poor, that cannot generate income, that need to look after maybe a wide area of people, but with low density and so on. I mean, it's this kind of allocation policies that will help address the inequalities.
I see.
And we need now to look at, the use of technology to help bridge the gap as well. The promise of technology is there, but I think from COVID we also learned, right, that online learning is not going to provide quality education for all, and then we need to learn the lesson from that and fix that. The danger with technology, and I think this is often underestimated or maybe just played down, is that technology, I think, is going to favor concentration, because I think the most important assets in a technology-driven economy now are the big data and the network. So if you have big data and you have a network, you're at a huge advantage, and that tends to create natural monopolies, if you like. So even if you've got new people, young people like yourselves with creativity and innovation, but if you need to have access to network and big data, and there are only a few people who can make money from that, it's still going to be difficult to get a more equitable structure.
I see. These are complex, interconnected issues. One last question from our audience. According to the Department of Mental Health report, our poverty rate is over 7% last year, meaning about 5 million Thai citizens are living in poverty right now. At the same time, the suicide rates are also increasing.
Right.
Some of our audience are concerned that poverty may have driven some of our peers into ending their life. How would we make our citizens live happily and choose not to end their life in our country?
Just a couple of comments first. I think poverty clearly does create stress, suffering, and clearly can affect mental health. I think the last couple of years, the problem of isolation as a result of COVID or COVID measures has made that even more acute a problem. So I've just been to a funeral of somebody who took his own life, and I asked the people who knew him, because I'd known him, and they say that he became more and more depressed because of the isolation, because his children and grandchildren were preventing him from going anywhere because they were afraid that he would contract COVID and so on. So isolation plays a part as well. So we hope that isolation, which when we overcome this problem of the pandemic, isolation will be reduced. But yes, it means that we need to tackle poverty and inequality to prevent these kinds of damages. But also, I think there is still room to continue to raise the awareness of the importance of mental health. I think when people talk about health, most people still think of physical health. and there is also a kind of stigma attached to people with mental health problems, which mean that they are unwilling to consult or are too afraid to consult because they don't want to have a label put on them that they have mental health problems. I think there's a need for a public education campaign to make people recognize that, you know, everybody can have a mental health problem. It's nothing to be ashamed of. It's something that needs to be that needs to be assisted, and we should have a system that encourage people to come forward to seek that assistance, and for people to provide that assistance, and for society to be understanding of people having mental health problems.
I see. My condolences to you, sir. Thank you for those insightful and fascinating responses and suggestions. Now I would like to pass the time back to the MCs for the next section. Thank you.
Thank you, Kun Thanakom Huntakun, and also Tan Abhisit. Those were wonderful answers, and I'm sure it had answered a lot of the questions that the viewer had as well. And now we're going to have a 5-minute break until 3 p.m. And we would like an opinion on the matter in our next session, which is a general Q&A session after the break. So if you guys are here, please vote your question choices on the poll that will pop up on your screen at this moment. The poll will be closed in 5 minutes.
And may we also remind you that the link for today's background Zoom is already in the Zoom's chat box. It is very important that all of you have it prepared for the group photography in the closing ceremony. Thank you.
Welcome back, everyone, to our last discussion. As for this session, we would like to introduce our third moderator, Kun Patawut Buttan, the co-founder of Beyond Public Health, who will be hosting this general Q&A session.
Right, and during this session, the audience will have the remarkable opportunity to speak with none other than Thailand's former Prime Minister, Abhisit Vejjajiva, about the issue of their choosing.
Please welcome Kun Patawut.
Hello. Well, thank you, Mr. Pim Pongsakwachkun and Ms. Tinpavi Thongongtun. And I would like to say good afternoon, Than Abhisit Vejjajiva, the former Prime Minister of Thailand. And I would like to say good afternoon to everyone in this event as well. Welcome to the general Q&A session. I am Patawut Buttan, the co-founder of this event and in charge as a moderator in this Q&A session. Apart from those two interesting topics that the former Prime Minister has shown us his vision, we have set up the vote regarding the participants would like to ask Mr. Former Prime Minister. So let's start with the highest rank on the question. So the first one, if you are the current Prime Minister, what would you do differently from the past to the next 10 years in order to make it impactful and meaningful?
I don't see the whole question. What would I do differently from the current Prime Minister on what?
Yeah. If you are you are the current Prime Minister of Thailand, what would you do differently from the past to the future to make it impactful and meaningful?
All right. I think my biggest concern at the moment in the country is that there is a gap between the younger generations and the older generations, with so many conflicting visions of what they want from the future. And I think one of the first things that needs to be done is to create a space where both generations can be brought closer together to understand each other, right? And from there, I think what I've said in the last two sessions concerning making sure that our approach to policy takes a holistic view and that our public sector is restructured to be service-oriented, providing the necessary welfare, be more decentralized, engages more stakeholders in society to participate, would then be key to driving changes for the next 5 to 10 years. But I think we badly need space for dialogue of those who have different visions of where we want to go. Otherwise, I think it's going to be difficult to try to push one way or another, because we just get stuck in the kind of situation we're in now.
All right. I would like to add a little sub-question to the same whole topic. You've mentioned about the reconstruction of the Thai public health. Well, so I would like to ask if you have the authority to change or to improve the Thai healthcare system, what would you do?
There are a number of challenges at the moment. I think the health coverage system is often underfunded, right? And I think apart from being underfunded, you have to recognize that in health, the expectations of ordinary people about what they see as basic services is not static, all right? Many procedures that were seen as luxury in the past is now seen as necessary. And when it comes to matters of life and death, it's very difficult to convince people that this is not for you. It just cannot be done. So we have to make sure that both the universal health coverage system, the social security system with its not going to be integrated into this main system, is adequately funded. And to do that, I think it's important to do a couple of things. The first is that the allocated budget must be guided by a formula that is scientifically based. And we must try to reduce discretion as to how much or how little the government this year or next year we want to give. All right, so we have to make this calculation as automatic as possible to make sure it's adequately funded. The second thing is we need now, and the second thing is the cost of healthcare personnel should be separated from the funding of coverage for people accessing healthcare. That will help to make sure that the medical profession and the health services staff who are very stressed in their jobs now get a fairer deal. I mean, I've seen the numbers concerning the hours worked by nurses and so on. It's incredible. It just isn't fair, and we need to make sure that they are adequately compensated for what they do. The third thing is we should now move to a more detailed, if you like, healthcare services for particular sectors. All right. So, for instance, we should now be targeting the health of children to be born, which is to say we have to give the rights to pregnant women to have access to certain things to make sure that the child is born healthy. All right. So it's nutrition, iodine, or whatever. Issues concerning reproductive health on the part of women, and also rights to have testing and monitoring. So mammograms, to detect cancers and so on. These, we need to be more detailed now. We need to be more, if you like, responding to the various niche demand of particular groups. That should be the next stage of the public healthcare system. We need to sort out the mess in Bangkok as exposed by COVID to have a more unified system, and where I think private hospitals have to play their part in a more equitable fashion when there is a crisis or a pandemic like this one. Again, strengthening what was already a success in the past concerning preventive healthcare and engaging people as part of the healthcare process. The healthcare volunteers, given the new challenges that are coming up, they will need to be used to take care of elderly people who are not going to be looked after in hospitals, but in their communities or on their beds in their homes, much more. There will be a huge demand, increase in demand for that as well.
Well, thank you. I hope that by separating the fund of the medical personnel, that would fix the problem of the delay of the salary for the medical workers that we're currently facing right now.
Yeah, I've been trying to get to the bottom of that because I've heard some complaints, and I've passed this on to the health ministry, but they were saying that it shouldn't happen. But
all right. Okay, let's moving on to the next question. The second runner-up. Again, if you are the current Prime Minister of Thailand, what is the strategy in order to open the country?
Right. I think we are already opening up. I think we have to set clear criteria And in doing so, we need to consult all the stakeholders and try to reduce uncertainty and inconvenience as much as possible. I'm just surprised that the government thinks that you can change the rules about people traveling in and out and expect travelers to be able to do that within a day or two. That's not how people plan cross-border travel. And I'm just surprised that doesn't seem to be factored in. I would then have maybe even separate and clear criteria depending on the countries we're dealing with, because I mean, the situation in various countries differ enormously. And in terms of trying to get our tourism income back, the biggest challenge is the fact that before China made up a third of the number of visitors, but she has no intention at the moment of opening up. And if I were Prime Minister, I would move pretty quickly to talk to them about, hey, maybe you want to try a travel bubble with us because your people want to come here and you know, our people want to go to China, and see what kind of measures that they would demand and see if we could accommodate. Well, because if everybody is back except China, we would still only be 2/3 of a way of getting things back, right?
Yeah, I agree with that. All right, let's move on to the last question.
And sorry, before we talk about the travel rules, the most important thing is to make sure that people see that it is safe to be here. Exactly. And therefore, you know, making sure that the infection numbers don't just keep rising, and creating trust with the numbers, which is being more transparent and doing what I suggested also earlier about providing details about the profile of people who are hospitalized and who become severe cases.
I'm totally agree with that. People need to earn the trust that they will be here and safe without getting COVID. Okay, now let's move on to the last question. But in order to do that, I would like the speaker who asked this question. The question is about how to apply digitalization to public health, similar to the successful Taiwan. I would like to ask the audience to ask by himself directly to you. All right, just give us a minute.
Hello. Oh, yeah. I was just asked for, as Mr. Patrick has said earlier. I was asking about the digitalization of the public health, and see how it could be done successfully, similar to Taiwan.
Okay. All right. I'm not sure I got everything because the sound was a bit uneven. This is about the.
I think he said that how would digitalization be implemented into the medical field?
The implementation of
the digitalization.
Okay.
Yeah, of the information.
Okay. Right. First of all, obviously you need the infrastructure, and I believe that the situation there is not so bad, but we just have to make sure that in faraway rural areas there is adequate infrastructure. And I would argue that the regulator of the telecommunications sector, which should have a sort of equalization fund, if you like, where they have money from the licenses, should be contributing more to investing in infrastructure in places where that's still lacking. That's the first thing. The second thing is obviously to train people to be able to use these tools. telemedicine, and I think it will help tremendously, because I know that we've experimented in many areas where you can have patients or people coming in and consult doctors that are in the big hospitals in town and cities around the country, but it needs training, right? To make sure that runs smoothly. But apart from that, I mean, that's just a sort of access to some basic services using technology as a facilitator. But there is so much more that we can do with digital technology in health. And that requires, I think the biggest, the key thing is how we manage health data, right? So if we have a clear set of rules about who collects health data, who owns that health data, who can access and use that health data and in what form in order not to violate privacy, and then use that to provide better services, I think it will be a tremendous boost to the quality of healthcare. And it's not just a question of providing care. With big data, we should now be able to identify the state of health of people in the various localities. So we can, for instance, get to some diseases that more Northeastern people appear to have than the rest of the country, and begin to make sure that there is adequate services to combat that, as well as beginning to look for why certain diseases are prevalent in the Northeast and why some are in the South and why some are in the North, using big data and the set of rules that I said need to be put in. Because at the moment, the public sector is failing at making use of big data, because each department is still not sharing data with other departments. And it's as if data are owned by departments, not by the government.
All right. I think the reason is it is because there is no trustable medium to connect between each department.
Well, there's a legal problem, because most of our laws will specify which department or which ministry is in charge of this, and the data that they collect can only be used for these purposes, which is why I say we need a different law to set out the rules about who can access and who can use data, obviously with the view to making sure that there is no violation of privacy.
All right, I'm totally agree with that. So thank you for the wonderful answers that you have provided in this event. I hope that this Q&A session will give the audience the enlightenment on the problem that we're currently facing right now. Well, now I would like to send back the spotlight to our MC. And thank you, Tan Abhisit, for this session as well.
Thank you so much, Tan Abhisit, for your enlightening and attentive answers. I'm sure those questions are pretty tough, and I think it's been very beneficial for all of us. And before we commence to the closing ceremony, we would like to take a photo with the former Prime Minister in this commemorable event.
And we highly encourage all our participants to turn on your camera with the background for our photos, which were sent into the chat box in the beginning of the event. So let's take the picture. I'll be taking the picture. If you could, please open your camera. All right, we will be waiting for some more time. All right, that looks like everyone. So, okay, more people are opening their cameras. Let's wait some more.
All right, tell me when to smile.
Okay, all right, I'll definitely tell you, sir. Okay, so now is a good time to smile, sir. Okay, 3, 2, 1. And the second page, 3, 2, 1. All right, I think that is it.
Right.
So before we commence the closing remarks, let us hear from Ajahn Gaman, Thammasat Pathaya's Vice Rector and the Chairman of Beyond Public Health Organization, who delivered a video of his speech due to the emergence of unexpected technical difficulties.
On behalf of Thammasat University, it is a great honor for Thammasat University to welcome former Prime Minister Abhisit Vejjajiva and all of the participants to our first ever Beyond Public Health webinar, Zero COVID to Endemic. The objective of webinar to emphasize our student leadership and to educate our students and people about this topic, to emphasize our students to be concerned about public health policy and strategy. Because Thammasat University have a motto, Thammasat love people and Thammasat for people. And in our public health Thailand, we have still so many problems, such as low socio-economic income, economic recess, rich and poor problem, inequity, distortion of the Thai population structure to become the senior society or aging society, and decline in birth rate. Changing the people lifestyle. All of these multi-dimensional problems can be solved with public policy. I would like to give a big thank for Dr. Pongsak Huntakul, who initiated this idea, and our students, Beyond Public Health teams, for creativity and made it happen. I would like to take this opportunity to express my deepest gratitude to our guest speaker, the former Prime Minister Abhisit Vejjajiva, for spending his time with us, sharing his experience and expertise. It is my hope that our next generation would be able to understand the larger perspective of the repercussion of public health policy. Moreover, it is all my hope that our students and young people would be inspired to be advocate for the good for everyone as health professional and as member of the public. Thank you, Beyond Public Health team, for spearheading this event. Thank you. ขอบคุณครับ
Yes, so thank you, Dr. Kaman. And before we end our program, let's hear from our representative of the Beyond Public Health Organization, Kun Thanakom Huntakul, to give his closing remark, please.
Thank you. I would like to thank Dr. Kamal Kumar Pawa, Chairman of Beyond Public Health, for his continued support, Ms. Pooncharat Nira Kunchai, our Creative Director, for all of her hard work behind the scenes, our MCs, International Federation of Medical Students Association, Thailand, for your cooperation, and my Beyond Public Health team, in which all of this would not have been possible without them. Thank you to all of the participants for attending our webinar. On behalf of the Beyond Public Health, it is my honor and privilege to thank you, former Prime Minister Abhisit Vejjajiva, for being our guest speaker this afternoon. We are indebted to you for the time you have given us and lessons we have learned from you. Thank you, sir. In one of your points, we have to recognize the uneven impact of the various groups of Thai people that disproportionately affects the lower income people. The social distancing policy is a luxury that many people in Thailand simply do not have, and that we need to address it immediately. It particularly resonates with me as it has been a revelation to me to this fifth wave of the pandemic that Thailand's public health system is in dire need of restructuring. We have gathered here today for something greater than ourselves, for healthcare workers on the front lines, for our loved ones, for our absent friends. By using what we have learned today, I urge all of you to yearn and pursue for a better and brighter Thailand COVID-19 policies that goes beyond public health for everyone. Thank you.
Thank you คุณธนาคมหุ้นตระกูลนะคะ and ท่านอภิสิทธิ์ค่ะ It was more than an honor hosting you this afternoon. Lastly, we would like ท่านอภิสิทธิ์ to deliver a take-home message to conclude this event.
I've already said a lot this afternoon, but let me be as brief as possible. The first thing is I'm speaking mostly to a young generation. The future is in your hands. We live in a country blessed with so many things, but also in need of a fundamental restructuring. You will have to be very active in playing the part in redesigning this country for your own future and for the future of the generations that come after you. That's the first thing. Secondly, we also cannot turn back the clock on globalization. So you're not just a Thai citizen, but you're a global citizen. And you'll be living in a world where many of the things that we do or many of the things that we see will be affected by global trends. And never forget that, because when you start dealing with many public policy issues, it seems to be a disease everywhere in the world that everybody thinks everything is local when there's so much global influence. Thirdly, I think if there's any the most important message this afternoon is to look at the name of the group, which is Beyond Public Health, and our emphasis on the holistic approach, the ability to see how things are interconnected, will help us deal with the problems much better than if we think that we can do sort of piecemeal quick fixes one by one. And finally, the most important thing is there's going to be a lot more uncertainties, a lot of new things that we will encounter. We should be humble enough to recognize the limits of our knowledge and therefore recognize the need to learn, but be ambitious enough to think that we can overcome all the challenges that come our way. Thank you.
Thank you so much, Tan Abhisit, for a resonating message for us all. And we sincerely appreciate and will cherish the time that you have given us today. As for our audiences, we truly recognize your patronage for our event. And of course, we're going to have an open to all of your feedback, comments, and suggestions. The link for the post-evaluation form for the event will be sent to the chat and is on the screen right now. We look forward to hearing from you.
ก็ขอบคุณท่านอภิสิทธิ์วันนี้มาก
ครับสวัสดีครับ
ขอบคุณมากๆครับสวัสดีครับ
And for our audiences, so please note that by filling up the post-evaluation form is a requirement for certificate of participation. So this concludes our first ever Beyond Public Health event by Beyond Public Health Organization in partnership with the International Federation of Medical Student Association Thailand, as well as IFMS ACICM. So please make sure to follow our social media account as shown on the screen right now to get updated about our next and upcoming events that will be happening very soon. So once again, I am Tinpawi Thongkongthun.
And I'm Team Pok's Wishkun, and we would like to wish you all the best of luck in your endeavors. And we'll see you all soon. สวัสดี
ข
ค
อ
รั
บบ คุณค่ะ สวัสดีค่ะ